Okay, so our PowerPoint is on facial nerve trauma by Ashley Montgomery and Cogni Atkins. I hope I said it right. So symptoms are weakness on one or both sides of your face. You might lose your ability to make facial expressions, and you may have difficulty trying to eat, drink, and speak clearly. It can also become difficult to close your eyes and blink, which can lead to damage to your cornea. So the diagnoses include radiological examinations, X-ray or scans, neurophysiological examinations of your facial nerve, and monitoring to understand how it works, and likely course of your condition. Tests include nerve conduction studies and electromyography. Physical examinations of your face to determine your level of facial movement and identify any abnormal movement patterns. Physiological assessments and photographic and video assessments of your face. So some frequent causes of facial nerve injury include skull-base fractures, gunshot wounds,
Sharp penetrating injuries such as stab wounds and disruption during surgical procedures, the location of the injury, initial presentation, and mechanisms of injury all play a significant role in determining treatment and long-term prognosis. How does facial nerve trauma affect speech? Facial nerve damage is responsible for lip movement of the lips and the cheek muscle tone. If damaged, the lips can become weak and the muscle tone in the cheeks reduce. As a result, it will be harder to speak and your speech becomes unclear. And it's also harder to pronounce letters such as P, B, and M. Spectrogram, if someone is suffering from a facial nerve trauma, the spectrogram will have less sound waves than someone who does not suffer from FNT. There will be a higher areas when consonants such as M, P, and B, etc. are pronounced due to the lips and cheek muscle tones being reduced. And these are our citations for the presentation. And that also concludes our presentation.